We looked at searching for drug information from package inserts. Now let's search for drug information by using Lexi-Comp, Macromedics, and Clinical Pharmacology.
Okay, so if you go to one portal, as long as you are on Loma Linda network, then you can go under apps and click on Clinical Desktop. And then once you go to Clinical Desktop, if you go down under Point of Care Tools, there's Lexicon. So if you click on the Lexicon, it will take you to the Lexicon app. If you specifically want Lexicon that only shows you the drug formulary for the medical center, you can click on MC. And if you want the Lexicon that shows you the drug formulary for Children's Hospital, then you click on CH. In this case, I'm not concerned about these formulary. I'm just going to use the general Lexicon because I'm just going to show you general drug information. So here's what Lexicon looks like. And in order to search for drug information, you basically search. You can search by drug name, or if you happen to have the NDC, you can also type it in. So let's say I will search for Genvoya. So you can see that Lexi Drugs is the is the database that has the drug information. There are also other databases that are available in Lexicon. So I'm going to click on Genvoya under Lexi Drugs. And it will take you to this page, which it has all the informations that's available in this database. One thing that's nice, if you ever want to know the pronunciation of a drug, you can always go to Lexicon and it will actually tell you. Now, unfortunately, it doesn't pronounce the brand names. It only tells you all the generic names. So if you click the play,
Elbaptegravir, Cobicistat, M-tricytidine, and tenofovir alafenamide.
Yeah, so that's one way, if you're, ever curious how to pronounce a specific drug, you can use Lexicon. Now you can navigate through it on the left-hand side. So, if you wanted to know how to renally adjust it, you will go under dosing renal impairment. So you can see if for Genvoya, if creatinine class is less than 30, use is not recommended. You can also see hepatic impairment, dose adjustment. You guys will learn about these terminologies next year. You will learn about hepatic impairment and what child PU class A, B, and C means. So don't worry about child PU at this time. There's also dosing recommendations for pediatrics. One thing that's not available in here is neonatal information. If you go, one thing that's useful is if you go to the pharmacokinetics section, it shows you the mechanism of action. It also has good kinetics information. So it tells you about the absorption, protein binding, metabolism. It tells you how specific drugs in Genvoya are metabolized. It also shows you bioavailability. If the information is available, it will show you. It also shows you half-life and excretion. So these are all useful that on a daily basis you may need to look for these information. So this is where you would find it. There's also adult patient education available. So if you want to give a handout to the patient, you can go to this page. It has basically frequently asked questions. There's also one for pediatrics. So the language is suitable for children. There's also images of, sometimes if it's available, you can also see the image. So let's go back to the monograph. If you want to see the adverse reaction, you can click here, and it has the adverse reaction. They're listed based on frequency. So, these are adverse reactions that occur more than 10% of the patients. And then it goes down to less frequently observed adverse reactions. Another thing that's useful is administration. So oral, it says administer with food. So if a patient asks you, should I take this with food over on empty stomach, or it doesn't matter, you can always look under administration. It shows you. So for Genvoya, it has to be given with food. There's also information about storage and stability. Let's see. So that's Lexicon in a nutshell. You can also use the Lexi-Comp app if you have it on your device.
So here's the Lexi-Comp app. The first thing you want to do before you actually use it, you want to update it. So if you click update, make sure you update Lexi drugs. So you have to check it. Mine happens to be up to date. Also choose interact for drug interactions and also IV compatibility. And if you want, you can just update all of them. And then once you check those and then click begin update, and then when it's done, then go look for drug information. So if you go back to the home page, if you click library and Lexi drugs and then you can search for Genvoya, and then all the same information on the website is available in the app. One nice thing is that you can use this jump menu to jump to a specific section. So let's say if you wanted to go to pharmacodynamic kinetics, then you go here. Let's say if you wanted pronunciation,
alpha-tegravir, copicostat, M-tricytabine, and tenofovir alafenamide.
Another thing that's nice, pricing is also available, so it tells you like what the price is.
Okay, now if you go back to one portal, instead of Lexicon, if you click on Macromedics, it will take you to the Macromedics website. So if you click on it, it's ready for search. So you can get similar information from this database as well. So if you type Genvoya, now you want the US version, so click Genvoya US. Again, you can navigate through it. If you wanted FDA users, it has, so in this case, it's just approved for HIV infection. You can also see off-label use, which this drug doesn't have any off-label use. And then also this is a nice tool if you want to know if there's a REMS for a specific drug, you can check through Macromedics. So in this case, there's no results available. So also there's monitoring that's nice. So as you work up your patients on rotation, this is a nice tool so you can see what to monitor on a patient who's on Genvoya, for example. Let's see. Other things, mechanism of action is nice. So it tells you how the drugs work. And of course, it also has medication canceling. So if you're about to cancel the patient, you can have a quick, review of what to tell the patient, and then you'll be good to go. This increases efficiency. So these are all under the section for quick answer. You can also look at the in-depth answers. So for example, let's say if we go to dose adjustment, it has a lot more information. Or if you go to pharmacokinetics portion, it has a lot of information. So if there's something that you didn't find, then in the quick answer section, try in depth, and then it gives you a lot more information.
So you can also use the Macromedics app. So fortunately, this one actually asks you if you want to update. So it's best to always update. Lexi-Comp doesn't ask, so you just have to do it manually on your own. With Micromedex, it does ask, and Clinical Pharmacology actually updates on its own automatically, so you don't even have to do anything. Okay, so here's Macromedics, and then if you want to get information on Genvoya, you just type it in the search box, and it shows you Genvoya, and it's nicely organized, so you can see adverse effects, for example. Yeah, so it jumps to adverse effects, so nicely organized. you go back, it goes back to the table of contents. So if you want to see clinical teaching, for example, here's clinical teaching down here. So if you were to talk to the patient, then there's some information that you can easily and quickly look at before you talk to the patient.
Now let's take a look at clinical pharmacology. So if you go to the clinical pharmacology on clinical key, it basically has the search box where you can search for drugs. So if you type Genvoya here, so as you type, it actually tries to show you the drug. So under drug monographs, it shows you Genvoya. So if you click it, then it has different information. So you can see here it shows you summary. You can also click an indication. So then it shows you FDA approved indications. There's also you can jump to labeled, which is FDA approved, and they also list them. So if you instead of reading this page, if you wanted to just see a list of all the indication, if you click on this, they will be listed. So in this case, it's just one indication. But let's say if you were to search for lisinopril, so you see as I type, it lists drugs. So I'm gonna click on lisinopril. So if I go to indications, you can see there are a lot of indications. If I click here, it actually lists them here, and you can click and it will jump to that section. But so labeled, it has acute myocardial infarction, heart failure, hypertension, and here are off-label indications. You can also see, for example, administration. If I click it, it shows you, in this case, may administer without regard to food. So it doesn't matter if it's with food or not. Then it has adverse reactions, pharmacokinetics, mechanism of action, and monitoring parameters. So you can actually play with it. So there's also pediatric monograph that you can look at. Now I'm going to go back to the home page. Now, clinical pharmacology also allows you to look at a list. So if you want a list of monographs, you can actually, go down the list. If you were looking for a specific drug and you just can't remember the name of it, or you don't know how to spell it, you can actually go through the list and look for it. So if acyclovir, for example, I can click on it and use pharmacokinetics. When it comes, you can also use the patient education if you wanted to cancel the patient. So if I type Genvoya, lisinopril, I'm in the wrong box. Here's drug product. So Genvoya. So then this is the the kind of information you can print for the patient.
So for the clinical pharmacology app, once you go into the app, you can actually start searching. So if you search the monograph for Genvoya, you click it and it has a nice table of contents. So you go to the section to get the information you want. So adverse reactions are nicely organized. Mechanism of action.